coronavirus continues to climb to more than 360, and the number of confirmed cases reaches at least 17,300, including 11 here in the United States. Should Americans be worried, and what can we do to prevent the spread of the virus? Well, joining me now is Dr. Manny Sethi, founder of Healthy Tennessee. Good morning.
Well, good morning, Tracy. Thanks for having me.
So I want to ask you, China Foreign Ministry says that some countries like the United States are overreacting, but we see the number of cases continuing to climb, especially here in the United States. Is the U.S. doing enough, and has the response been fast enough? Do you think this is an overreaction?
You know, Tracy, I completely disagree with the Chinese. I think this is a global pandemic and is going to be a big problem. You know, the issue with the coronavirus is that it has a very high transmission rate, but a very high incubation time. And what that means is you may carry this thing around for 14 days and you don't even know you have it. So in the meanwhile, you're going to give it to a lot of people. And that's why I think it could be a real problem for Americans. Now, yes, there have been 17,000 cases reported, mostly in Wuhan City in China, but we're thinking that it's about 100,000. And I completely disagree with the Chinese, and frankly, I think that the U.S. government should sanction China because they knew about this from the end of December when an ophthalmologist saw a patient with a case, and you know they showed up at his doorstep and told him not to tell anybody, and that's a real problem.
That's right. And we have 24 countries that have been impacted by this. 11 cases here in the United States. And the most recent one that we just saw in California, a husband returned from the area, gave the virus to his wife. How can we really protect ourselves? As you said, transmission is very easy.
Well, that's a great question, Tracy. There are a couple things that you can do. The first thing is just hand hygiene. Wash your hands a lot, because this is transmitted by bodily fluids, by droplets from the air that come on the ground. So wash your hands. You know, people can transmit this disease within about 6 feet of one another. So if someone's coughing, encourage them to cover their mouth, their nose. Wear a mask if you can, if you're sick. Now, you know, they're saying that the mortality rate is about 3%. So 3 in 100 folks who get this could die. And usually that's people who are older or sicker, younger children, babies. So especially people who are immunosuppressed or have weak immune systems really need to take precaution, because that's the target of this disease and the people who could really pass away or die from this.
Now, I want to ask you quickly before we let you go about this new study from the Commonwealth Fund. It came out, it said Americans spend far more than people in other countries but for health care, but it is not helping them live longer. We're paying more than people in Australia and Canada, in the UK. Why do you think that is?
You know, that is such a big problem. Healthcare in our country is 18% of our GDP. That's because in our country, we are paying to treat disease and not promote wellness. I'm running for the U.S. Senate here in Tennessee, and I run this nonprofit called Healthy Tennessee. And over 10 years, we have been trying to get people to get on the front end of health, meaning why wait and spend $10 on the back end to treat diabetes when we could get on the front end and spend $1 to promote education? And Tracy, that's what we need to be doing all across the country. That's why we're spending so much. And so I very much agree with what you're saying in this study.
Doctor, thank you very much for joining us this morning. We appreciate it.
Hey, thank you, Tracy.
Thanks.
All right, let's take a look at a really